Hi, I'm Dr. Claudia Kim, cosmetic surgeon here at New Look New Life. Today, we're going to talk about one of the most elegant natural ways to restore volume and sculpt the face and body, which is fat grafting. So you may have heard it being called fat transfer, or more specifically for the butt, the BBL or the Brazilian butt lift. But here's the general concept. We suck out the fat from an area where you don't want it, and it's commonly the abdomen, the waist area, the love handles or thighs, and we transfer to an area that needs volume or more contour. So we're essentially recycling your own fat from where you don't want it and put it where you do need it to enhance, to restore, to rejuvenate. And how great is that? We're being environmentally conscious and getting a refresher at the same time. Where can we put the fat? So for the face, we can add volume to the under eyes if you're seeing a little bit of hollowness, or cheeks or the mid-face area if that area has been falling or kind of sinking down. We can put it into temples if that's looking a little hollow, the chin, the jawline, the smile lines, or the marionette shadows. For the body, we can actually put it into the breast. Usually you get about a half to a full cup of volume, and it's your own fat, so you don't have to worry about changing out implants every 10 years. Males can also benefit from fat grafting to the chest area if they're looking for more volume to the pecs, but if they don't want to do pectoral implants, or adding to the biceps, the triceps, or the calves for increased shape and definition. You can add fat to the hips, or specifically the hip dips for a more rounded look from the behind, or you can do the full BBL or the Brazilian butt lift for increased projection and shape. Or you can put it into the hands to restore the youthfulness and volume to address the changes that we see when we get older. So fat is very versatile because it's not just volume. Fat also contains these stem cells and growth factors that can actually improve the skin quality over time. How does the fat grafting procedure work? So again, we gently harvest or suck out the fat with liposuction. The fat is purified, so you remove the extra oil, the fluids, and the damaged cells. And using a micro droplet technique, the fat is carefully layered into the new desired area. And this technique allows the fat to establish a new blood supply so that it survives in its new home. However, not every fat cell survives the transfer. So most people keep about 40 to 60% of the fat, so we always slightly overcorrect to account for that natural resorption of fat. How long do the results last? So once the transferred fat becomes vascularized, as in they got the blood supply, it becomes living tissue, and it lasts much longer than fillers. Now, a common question that I get asked is it permanent? Now, fat grafting is not permanent because we are constantly losing volume, collagen, and elasticity as we get older. And the rate of that loss really depends on the person's age, their body fat composition, their genetics, and environmental factors. So the fat can last 2 to 3 years in some individuals, or even up to 7 to 8 years in other people. Let's talk about possible temporary side effects, such as the swelling, bruising, tenderness at the liposuction and the grafted sides, temporary numbness. Other possible risks are asymmetry, or irregular contouring, or fat lumps, or fat necrosis, or partial fat resorption requiring additional sessions of fat grafting. For body fat transfers, specific risks include the fat not surviving evenly, or the rare risk of fat embolism if not injected in the correct plane in the butt. So this is why technique training and surgeon selection is so crucial. So after the fat grafting, I usually advise patients to avoid direct pressure to the area that they grafted. So it's not recommended to sleep on your face if you did fat grafting to the face, or you have to sleep on your stomach if the fat was placed in your butt, and obviously you have to sleep on your back if it was grafted to the front area. And I do recommend this for at least a month. So who is a good candidate for fat grafting? Individuals who want natural volume, has areas with stubborn fat that they want to harvest from, and prefers an option without having to use synthetic fillers or implants. If you're seeking long-lasting, soft, natural volume, fat grafting may be ideal for you. We'll evaluate your anatomy, your goals, and your lifestyle to design a treatment plan that is safe and beautifully tailored to you. Fat can be your friend. Thanks for watching. If you like these videos, give me a like and a follow.